Gestational diabetes, moving your way to a healthy pregnancy. Hi, my name's Bianca Penning and I'm an accredited exercise physiologist. I'll be here today to talk to you about exercise and how this can help you during your pregnancy with gestational diabetes. Let's take a little look at the overview of what we'll be discussing. What is gestational diabetes? Insulin resistance explained. When and how it is diagnosed. How do I manage gestational diabetes? Blood glucose ranges to aim for during pregnancy. Reducing the risk of complications for mum and baby. The benefits of exercise for mum and the effects on blood glucose management. What exercise during pregnancy should look like. Fit during pregnancy, so the frequency, intensity, type and time of exercise during pregnancy, as well as some considerations and safety precautions to take, as well as the long-term benefits. So, what is gestational diabetes, or sometimes referred to as GDM for short? Let's take a quick look at what it is and why gestational diabetes comes about during pregnancy. So, there's too much glucose in the bloodstream. So when there is too much glucose in your bloodstream, the body is not efficiently removing the glucose from your blood so that it can be stored or used as energy. This results in it remaining in the bloodstream. Why is the body not removing the glucose? During pregnancy, the placenta produces hormones that cause insulin resistance. Insulin resistance affects the body's ability to remove the glucose from the blood and store it in our cells. When the body cannot keep up with insulin requirements during pregnancy, the blood glucose levels rise above the recommended ranges, and a diagnosis of GDM is made using the oral glucose tolerance test. Too much glucose in the bloodstream can be unsafe for mum and baby if not managed throughout pregnancy. So here you'll see, this is an example on the left of blood glucose at a safe range within the bloodstream. And when insulin resistance is occurring, extra blood glucose builds up in the bloodstream and there is more in there. When and how is it diagnosed? During 24 to 28 weeks of pregnancy, the reason it is tested for so late, when you are more than halfway through, is due to the hormones the placenta starts to produce around this stage of pregnancy. It is at this point that it'll be able to be determined if there is insulin resistance occurring and blood glucose levels rising above the recommended ranges. The oral glucose tolerance test looks at the body's ability to process glucose. Therefore, when you get your oral glucose tolerance test, you will need to be fasting so that the technician can check your fasting blood glucose level first. You will then be given a drink which contains exactly 75 grams of glucose. You may be wondering why you get such a sweet drink, but in reality, this is the same amount of glucose as you would get from eating, say, a large bowl of pasta, 2 sandwiches, or a medium bowl of rice. So for a diagnosis to be made, two out of the 3 levels need to be above the recommended ranges for a diagnosis. These levels are fasting glucose, more than 5.1 millimole per litre. The 1 hour glucose needs to be above 10 millimole per litre, and the 2 hour glucose needs to be above 8.5 millimole per litre. If you look at the graph, the blue line shows the normal response to drinking a 75 gram glucose load, as it has all 3 readings below the recommended ranges, whereas all the others have at least 2 readings above the recommendations. So what exactly is insulin resistance and why does it result in too much blood glucose in the bloodstream? Carbohydrate metabolism and insulin resistance. Let's look at what happens when insulin resistance is taking place in our body. So carbs are eaten, then they move down to the stomach where they are digested into glucose. Glucose then enters the bloodstream. When there is no insulin resistance occurring, the pancreas senses this and releases insulin into the bloodstream where it opens the doors to the cells and lets glucose pass out of the bloodstream and into the cells. However, during pregnancy, The mother's body produces hormones in the placenta, and it's these hormones that help the baby to grow and develop. However, during pregnancy, these hormones can also cause insulin to not work as well and act as a block for the insulin to open the cell doors. Therefore, the blood glucose levels start to build up in the bloodstream, and because of this, the mother's body needs to produce more insulin during pregnancy. This might be 2 to 3 times the normal amount of insulin. And if the mother cannot produce enough insulin and keep up with these demands, the glucose has nowhere to go and continues to build up in the bloodstream. This is gestational diabetes. So how do I manage gestational diabetes? There are a number of ways you can successfully manage your BGLs during your pregnancy, and your healthcare team will help with a management plan suitable for you as your pregnancy progresses and your individual needs. But here are just a few. Physical activity and exercise, which we will be looking at closely today, healthy eating, mindfulness, blood glucose monitoring, weight management, and the use of insulin. So what are the blood glucose ranges during pregnancy? Note, different centres around Australia can use slightly differing measures. However, today, these are the fasting capillary blood glucose should be less than or equal to 5 millimoles per litre. Post-meal readings should be taken from the time after you take your first mouthful. So 1 hour blood glucose after commencing your meal, less than or equal to 7.4 millimole per litre, and 2 hour blood glucose reading after commencing your meal, less than or equal to 6.7 millimoles per litre. Let's have a look at well-managed blood glucose levels and how they can decrease the risk of the following. So for mum, it can decrease the risk of a big baby, also known as macrosomia. Macrosomia can increase the risk of traumatic pregnancy outcomes, such as increased risk of cesarean delivery, increased risk of preterm delivery, and/or increased risk of problems during labour. Some women may elect to have a baby by C-section, but this is different from having to have one due to a large baby or failure to progress. It can also reduce the risk of preeclampsia, also known as high blood pressure, as well as decrease your risk of type 2 diabetes later in life. And for the baby, shoulder dystocia during birth, jaundice, neonatal hypoglycemia, and this is more likely if the mother has prolonged and consistent high blood glucose levels during pregnancy, causing the baby to produce increased levels of insulin that continues after delivery when glucose supply has been cut off. Respiratory distress, as well as increased risk of type 2 diabetes later in life. So what are the benefits of exercise during pregnancy? The best thing about exercising when you are pregnant is it benefits both you and your baby. And when you have GDM, it's also a great tool that can assist in the management of your blood glucose levels. Although some women tend to shy away from exercise during pregnancy out of fear of adverse outcomes, it is a safe and effective form of management for GDM, and I encourage you to do so if it is safe and you have no other contraindications that will affect your ability to partake in exercise whilst pregnant. So this would apply to you if you're a person who hasn't been engaging in regular exercise or have not been physically active before becoming pregnant. In this case, I would say start slow and move how it feels right for you. Consult with a medical professional prior to commencing an exercise regime just to get the okay to start. And in the beginning, focus on moving every day, moving mindfully, and where you can do it, outside in the fresh air to get some vitamin D as well. An accredited exercise physiologist can assist if there are special precautions that you need to take. So let's take a closer look at some of these benefits before diving into the detail around exercise and pregnancy with GDM. So what are the benefits of staying active during your pregnancy? Improved mood, self-esteem, concentration, and mental health. It can keep you fit and prepare you for the birth. Improved recovery time after the birth. Help maintain a healthy pregnancy weight. Reduce the risk of your baby growing too big. Improve your overall health. Improve control of blood glucose levels. And reduce pain and discomfort associated with muscle pain. How exercise affects your blood glucose levels. Just like choosing the right types and portions of food can help with the management of your blood glucose levels, exercise can also assist in achieving a more wave-like response versus a roller coaster response, which you can see in the graph with the blue versus the orange lines. This is because exercise provides an insulin-like response to removing glucose from our bloodstream. It can effectively reduce the occurrence of significant postprandial spikes in blood glucose levels. By using exercise to reduce the intensity of these spikes in blood glucose levels, we're helping to reduce the amount of glucose crossing the placenta and affecting your baby. And instead, it's being stored in your muscle cells. It can target insulin resistance by using your muscles that also provide an insulin-like response. You can move more glucose out of your bloodstream with more muscle contractions. And this might be in the form of aerobic, strength resistance training, swimming, and many other types of exercise. So, what should exercise during pregnancy consist of? A combination of both planned and incidental physical activity, which we will discuss, 30 minutes or smaller bouts throughout the day on most or all days, functional and pregnancy-specific exercises, mindful movement. It must be safe. In regards to functional, this refers to including exercise that are going to help your body keep up with the demands of being pregnant, as well as after you've had the baby. They need to be functional to keep you moving strongly and safely as your body makes significant changes throughout your pregnancy and postnatally. So let's look at physical activity and what it involves. Physical activity as a whole includes planned exercise, such as an exercise class, and it includes incidental activity, which is movement that we find ourselves doing throughout the day, such as housework, walking upstairs, or walking the dog. So physical activity involves any bodily movement resulting in energy expenditure. So both planned exercise and incidental activity. So planned exercise includes resistance strength training, aerobic exercise, and flexibility and balance, and normally would take up a larger proportion of our physical activity triangle. Incidental activity, like I mentioned, is any movement that occurs throughout the day. So this triangle is according to the guidelines of physical activity, but it's okay if your physical activity doesn't match up to this during pregnancy or if it looks a little different. Perhaps your incidental section will take up a greater portion compared to planned exercise during pregnancy, and that's okay. It's totally okay if during pregnancy that your total amount of physical activity doesn't match up to this triangle. You should listen to your body and only engage in physical activity that feels best for you and your body. So let's look a little closer at planned exercise. It's planned, it's structured, and it's often repetitive. So time, it should take 30 minutes on most days or all days if possible. It might include a vast range of different modes of movement, but it should also be pregnancy specific, especially when it comes to exercise classes. If so, the pregnancy classes should be run by a health professional with qualifications in pre-postnatal care. So what should the exercise intensity look like? Moderate. So this means maintaining a conversation, but you should be able to notice an increase in breathing and heart rate. Low intensity may also be suitable if you haven't been exercising prior to pregnancy. The main thing though is to listen to your body and take note of what your pre-pregnancy exercise levels are. When is the best time of the day to exercise? Research has found that blood glucose levels that spike following consumption on meals are the ones that we should target to best manage our risk of long-term complications. So, postprandial, or another word for blood glucose levels following a meal, these blood glucose levels often see a significant increase due to the breakdown of our food, an increase in glucose and the body's slowed process of getting that glucose out of the bloodstream due to the body's resistance to insulin. So this is when we would suggest, if possible, to do your exercise. Also looking at what's going to suit you better, once per day versus smaller, fewer bouts, as well as the best time. The best time is going to be the best time that suits you. You are going to be most successful at completing daily movement if you choose a time of the day that is going to best suit you, as well as whether one bout or fewer smaller bouts will benefit you better. So what type of planned exercise is best? It should be individualized, a combination of aerobic and strength. It should include pelvic floor muscles, and it should be functional, as well as safe. In regards to individualized, it must suit your current health and take into consideration your fitness, exercise involvement prior to pregnancy, as well as any aches or pains you may be experiencing during your pregnancy. Now is not the time to start a crazy exercise regime, especially if you haven't been exercising prior to becoming pregnant. Strength resistance training doesn't necessarily mean lifting huge weights. It might be working out with resistance bands, which are a great option during pregnancy, light hand weights, or even your own body weight. It usually involves exercises that involve a push-pull, extension, flexion, or a rotation movement with added resistance to increase the workload on your muscles. So in other words, it makes it a little harder for your muscles to perform the exercise. For example, performing a squat to performing a squat with a weight. If you are someone that has never done exercises such as these, body weight only will be enough to give your muscles a good workout. Aerobic can be walking, jogging, swimming, anything rhythmic in nature, and can be a great form of exercise when pregnant also. However, every bit of movement can contribute to a healthy pregnancy, birth, and baby. How your body is changing will affect the type of exercise that will be suitable for you at the time. So do what you can do and don't overdo it. Do what makes you feel good for your mind and your body. Try something different if you need be, like swim classes for pregnancy, yoga classes for pregnancy, and I recommend that they are run by a health professional that is experienced in training pre- and postnatal women. Your body goes through a lot of physical changes during pregnancy, and it is highly important that you are performing exercises that are safe and only going to benefit you through and following your pregnancy. When engaging in flexibility stretching type exercises, do keep in mind that women's ligaments become extra relaxed during pregnancy due to hormones that are preparing the body for birth. So being aware of this is important so you don't go beyond your body's limits and cause injury. Pelvic floor muscles exercises are also important for all women to be doing during and quite soon after birth. I recommend, if they are something that you're not familiar with or you just aren't sure of if you're doing them correctly, organize to see a physiotherapist that specializes in women's health, and they can check the function of your pelvic floor muscles. If you think you are happy with your ability to activate your pelvic floor muscles, maybe save the check-in with a physio until after birth, especially if you are having concerns with feeling like you aren't able to hold your own or anything that doesn't feel quite right, as a lot of concerns after birth can be effectively rehabbed if checked out earlier rather than later. And safe. Appropriate exercises at the different stages of pregnancy is essential, and there are a number of modifications that can and should be made, which specialized health professionals will be aware of. Now let's take a look at incidental activity during pregnancy. It's more often unstructured, and it's movement that occurs throughout the day, such as walking, grocery shopping, housework, walking to school or work, walking upstairs, or washing the dishes. It's a very important physical activity that during pregnancy, and can be an easy way to incorporate other exercise throughout your walk, such as adding some squats or sit to stands at a park bench as you go for your walk. Let's look at how we can incorporate incidental activity. By small amounts of exercise throughout the day. If 30 minutes of exercise is too much for you, see when and where you can do 10-minute bouts throughout your day in order to achieve an accumulative amount of 30 minutes of exercise. Use your coffee to catch up with a friend and include some physical activity like going for a walk. Sit less and move more. Choose to walk where possible instead of sit. For example, where possible, walk to the shops instead of drive. Take the stairs instead of the lift, where possible when pregnant, and wash the dishes instead of using the dishwasher. The third way is to break up sedentary time. For every 30 minutes of sitting, see if you can stand up, move your body, have a stretch, have a walk, move how you feel is best. Housework tasks broken up throughout the day can be a very helpful way of achieving your incidental activity. So let's take a look at some considerations and safety measures to be aware of when exercising during pregnancy. Include a 5 to 10 minute warm-up and cool down. Drink plenty of water during and after. Avoid changing positions quickly. This is important as during pregnancy our blood pressure can change throughout our pregnancy. So it's important to make slow movements so that we don't get dizzy. Wear loose clothing, avoid overheating. Avoid exercising when hungry, unwell, or have a temperature. Stop exercising if you experience chest pain, dizziness, back or pelvic pain, calf pain, or sudden swelling on ankles, hands, or face, contractions or vaginal bleeding, or a decrease in fetal movements. Avoid exercises that involves laying on your back past 16 weeks, and modify abdominal exercise to reduce load on your abdominal muscles. Please remember that having a baby, no matter how you deliver, is no small feat. It requires strength, effort, mentally, emotionally, and physically. Being able to keep up exercise throughout your pregnancy, in whatever form that is for you, it will help you to feel strong and capable for the birth and beyond. This is important for your health, your baby's health, and to reduce the risk of developing type 2 diabetes later in life. Remember, every individual's healthy weight gain is going to be different. So if you are concerned about this, talk with your medical team to determine what is the right range for you. By using exercise to manage those blood glucose levels and keep them in those recommended levels, we can help reduce the amount of glucose that your baby is going to receive via the placenta. And this can help to reduce the risk of the baby growing too big, which I mentioned in part 1. Exercise and keeping active won't just help with your blood glucose levels and all of the above mentioned, but it can immensely help with your mental health and emotional well-being during pregnancy. Growing a baby can be very stressful at times, and we might find ourselves worrying about things, feeling uncertain about things, and exercise can provide you a fantastic opportunity to take a moment to forget about these concerns, breathe, and focus on the exciting parts of your pregnancy. Throughout the 3 trimesters, you may experience different pains and aches in different areas of your body as it's changing very rapidly, and pregnancy hormones are also affecting our ligaments. Plus, the growing bubba inside is also putting pressure on different body parts. Keeping this in mind, I think it's important for women to know that not all of the aches and pains just have to be dealt with, but there are particular exercises that can help with specific concerns. Pregnancy can see different women experience different pains and discomforts in different areas of the body. For some, it may be in the lower back, some pelvic girdle pain, hip pain, others abdominal, shoulders or leg pain, but can include many others. Some women may experience very little muscle or joint pain, but every pregnancy is different. However, muscles and joint pain is common, and this is due to all the hormone changes going on in your body, causing ligaments to relax and stretch, and the growing baby that is maneuvering in particular areas. The change in weight distribution also changes your center of gravity, resulting in different muscles working different jobs, so to speak. This is where exercise comes in and can be very helpful to reduce some of the muscular and joint pain you are experiencing. This should be done with the advice of an accredited exercise physiologist or an exercise professional that is qualified and experienced in working with pre- and postnatal. The goal of exercise during pregnancy is to make you feel confident, strong, and empowered throughout your pregnancy and post-baby. So let's quickly look at the long-term benefits of regular physical activity beyond having your baby. It can create healthy habits that are then going to positively affect you and your child. By continuing physical activity, the body becomes more efficient at glucose storage and use, therefore helping to assist in reducing the risk of type 2 diabetes for both you and your children. So remember, there are many health professionals here to help you, so don't panic and don't be afraid to ask for help. You can still have a healthy pregnancy, birth and baby with a management plan. And GDM is likely to go away after your baby is born. And it is still possible to reduce your risk of developing type 2 diabetes later in life. For diabetes in pregnancy multicultural resources, you can go to the following website or use an interpreter through TIS and call our helpline on 1-800-637-700. You can find other support and resources, GDM specific, on the NDSS website at this website. The NDSS also has a number of services and support. Thanks for watching. If you have any questions, please don't hesitate to contact one of our health professionals on the NDSS helpline on 1-800-637-700.